Thank you so much for joining us this afternoon. We are really excited to see you. I think we had 65 people register for this meeting, and there's already more than 50 people on the meeting. And in my opinion, when 50 people show up for a discussion about family, friend, and neighbor care, it's like a very, very good day in my world. So I'm really excited to see all of you today. I'm going to ask that you take a moment to introduce yourself in the chat and share a little bit about where you are joining us from today, both your organization and your location, and also how you currently work with FFNs or how you hope to work with family, friend, and neighbor caregivers. My name is Natalie Renew, and I am the Executive Director of Homegrown, and really excited to be co-convening this conversation today with my colleagues at the Stanford Center of Early Childhood and the Rapid Survey. So before I turn it over to the team at Rapid, I want to just share a couple things on the agenda.
I don't take the transit into Penn Station.
We can get started. So firstly, maybe a little bit of housekeeping. This is a meeting and not a webinar. So please keep yourself on mute if you are not speaking. And I'm hoping we have some time for some dialogue and discussion. But if you are not talking, we'll ask that you please keep yourself on mute. We are recording the event because there are a number of folks who could not join us today and would like a recording. So I'll just let you know that this event is being recorded. And super excited to see so many of you joining us today. In terms of our agenda today, we are going to talk a little bit about the Rapid survey and take a look at some of the data that Rapid collects. We are then going to hear from a community partner in North Carolina, talking a bit about how access to data supports their work in meeting the needs of family, friend, and neighbor caregivers. We're then going to talk about some opportunities to partner with the Rapid team to recruit family, friend, and neighbor caregivers from your community to the survey, and have some time for some Q&A and discussion. So what else do I want to say? Before I turn it over to Katie, I just want to share that Homegrown has really been proud to partner with the Stanford Center on Early Childhood and the Rapid survey. We, as a national organization that works on the issue of family, friend, and neighbor, have really struggled to do our work without timely and relevant data. And, there is one national source of data for family, friend, and neighbor care outside of Rapid, which is the federal data, which is updated every 7 years. And, now that data set is from 2019. So it's from before the pandemic. And I think, is important, but not really telling us what's going on. So, we are so excited about the work that Rapid is doing to create a timely, current, and relevant set of data from family, friend, and neighbor caregivers throughout the country. And at Homegrown, we use this data almost on a daily basis to inform the programs we design, like our guaranteed income pilot, but also to inform our policy and advocacy work. And I think for many of us that are on this call who care deeply about lifting up, supporting, and amplifying the needs of family, friend, and neighbor caregivers, we know that data is really critical to doing that work. So I'm really glad that you are all here to get involved with this project and think about, how we can build this national data set together. And I'm really thrilled to turn it over to my colleague, Katie, at the Stanford Center on Early Childhood to take us through the rest of the presentation.
Thank you, Natalie. Hi, everyone. Thank you so much for joining us today. My name is Katie Nicolau. I'm a senior coordinator on the Rapid Survey project at the Center on Early Childhood at Stanford, which is where the Rapid Survey is based. Let me get our slides here. Our project launched in April 2020, so just over 4 years ago now, to understand the experiences that families with young children were facing during the COVID pandemic. And the first survey that we put out of households with at least one child under age 6 was fielded in early April 2020. So a year after gathering information from households with young children, we launched a parallel national survey of childcare providers to better understand how other adults who are caring for young children are faring. And Rapid has proven to be a powerful tool to listening to families and childcare providers in real time and to amplify their voices with the aim of promoting data-informed programs, advocacy, and policymaking. To date, we've reached over 20,000 caregivers and over 7,000 providers in all 50 states. And both of Rapid's national surveys are online surveys that can be taken in English or Spanish using any device that connects to the internet, like a computer or cell phone. Participants are compensated for their time taking the survey, and our core questions focus on topic areas such as material hardship, health and well-being, and childcare, some of which we'll dig into shortly. And in terms of the study design, Rapid's approach is a little bit different in the sense that we recruit and collect initial data from first-time participants on an ongoing basis, while also fielding monthly surveys to collect data from ongoing participants. So that way, participants can be added to the study continuously to collect snapshots of data across time and to assess trends longitudinally. And we really rely on relationships with trusted messengers and local community organizations, as well as parent and provider leaders, to connect and maintain engagement in the survey with parents and providers across the country. So today I'm going to share some findings from our national survey of childcare providers and specifically focus on some of what we've come to learn about FFN providers, family, friend, and neighbor providers, through this work over the past few years. So this slide shows the trend of providers' rate of material hardship by provider type through August of last year. And material hardship is we define it as difficulty paying for basic needs in at least one of the following categories: food, housing, utilities, childcare, healthcare, and well-being needs. And it's fluctuated to some degree, as you can see, since our provider survey launched in early 2021. This first data point, February 2021, was before the first, or looking back retrospectively to when the first survey was fielded. But you can see that the overall rate has remained high among all types of providers since that time. And the dark gray and green lines here, you can see that center teachers and FFN providers have consistently reported the highest levels of material hardship, with an average of 45% of both provider groups reporting hardship overall from February 2021 through August 2023. And we know that these types of providers tend to have the lowest incomes, which likely contributes to higher rates of material hardship. And we've also included some more detailed questions at various points in time about providers' experiences of hunger and food insecurity. And we've used a set of survey items from the USDA that ask about experiences of hunger, like skipping meals, not having enough money to purchase food, and not being able to afford balanced meals. And this really sets those experiences apart from hardship more broadly that I touched on in the last slide. So here we see again that FFN providers and center teachers have consistently reported higher rates of food insecurity compared to other home-based providers and center directors. And in particular, FFN providers' hunger rose dramatically in the fall and winter of 2022. And then in July 2023, 53% of FFN providers surveyed reported experiencing food insecurity, so over half. We've also dug deeper into the area of housing hardship to understand providers' experiences, and we've used a different set of questions, again, more than our more broad hardship questions I touched on earlier. And providers have reported high levels of concern about housing affordability, eviction, and foreclosure, as you see here. Between March 2020 and June 2023, about 43% of providers said they were worried about not being able to pay their rent or mortgage. And among providers who rent, 41% were worried about being evicted. And among those who own their homes, 26% said they were worried about foreclosure. So both of which represent increases from similar measures we reported in spring 2022. And I'll share this quote here from an FFN provider in Michigan that was offered as a response to one of the open-ended questions that we've included in the survey. I shouldn't be destitute or homeless, which is what will happen to me in maybe 6 months when I run out of money completely. I'm scared of my future. And it's important to note as well that housing stability is particularly essential for providers for whom their homes are also where they run their business and what serves as the learning environment for children in their care. So those are just some findings from our survey that I wanted to share, but I'd also like to share a bit about how data collected in the rapid surveys are used. And one of the primary ways we use the data is in fact sheets that we publish on our website, which is rapidsurveyproject.com, about every month or so, which focus on a variety of survey findings. And I've shared on the left here some of those publications that have been focused on childcare providers. And we've seen rapid findings also often be picked up by reporters and the press, as well as highlighted by our partners in their publications, like, for example, 0 to 3 State of Babies yearbook, or in blog posts and editorial pieces. And there's some snapshots of some of those headlines here as well. And another way that rapid data are frequently used in cases when findings from any of these publications I've mentioned or from presentations are referenced in discussions about national or state and local policy. So as you can tell, there are many different ways that rapid data are used, and I want to underscore that in using rapid data, participant information is always protected, and we never share identifiable information. So I will be back to speak to you a bit more in a little bit, but for now I'm going to pass it over to Aurora Swain, who's the Director of Operations at Families First in Cabarrus County, North Carolina, who's going to share some reflections on engaging with FFN providers and data about FFN providers' experiences. So I'll send it over to you, Aurora. Thanks for being here.
Aurora, are you there? I know that she was joining us from another meeting, so she may have been, oh, there we go.
Hello.
Hi, Aurora. Thank you so much for joining us. We were hoping you could share some of your reflections on using data to support family, friend, and neighbor caregivers in Cabarrus County.
Yes, thank you so much for having me. We are in another meeting, so I'm just going to be super fast. Thank you so much anyways. Yeah, well, my experience right now is with our family childcare, is with our Hispanic families. So we are able to help them because we know where they are located by, it's like a word of mouth for us. So I'm always kind of very careful when I go to their homes and try to provide certain kind of like safety that, you know, they are okay with me. Like I can go and like recently we had one that heard about us and kind of was waiting on us to reach out to her, if that makes sense. So we were able to provide some resources for her. So now with having her under our umbrella now opens the door for other that are on the radar that are kind of like little by little coming to the light with us.
Awesome. And Aurora, can you just share a little bit about how Families First advocates for family, friend, and neighbor caregivers, how you use your experience in the community and data to advance improved policies for FFN caregivers in North Carolina?
Sadly, I just have to be very honest, you know, for us on the policy is difficult because as we shared before, on my fight or my battle is because a lot of these caregivers that we have, these beautiful ladies, they are undocumented. So sometimes for us, it's a big stigma, like they don't want to come to us, or even when I share a resort for them, is kind of making them sure that no immigration status is going to be affected, you know, stuff like that. So when I go and I try to make policies with or see how they apply to them, a lot of the policies are not tailoring for them, you know, like they're all these wonderful things, but not for them. If that makes sense. Like even, for example, what we do in our other networks that we offer education or continuing education or anything else, you know, they're eligible because they have a social security. So the policies apply for them, but for our Hispanics, sometimes it's not the case. The majority of the cases. So we're always advocating and looking into things like, hey, can they get an education even without a social security? Or is there any way you can give them a CPR class, even though, you know, you need certain information, stuff like that. So we're always trying, it's not that I don't want them to, or like, I don't want them to go through the process, but I know the process will not apply to them, if that makes sense.
Yeah, totally.
It's like
But
educating the people, because I'm sorry, sometimes even in meetings we go like, well, they have to go through the process to get licensed. Well, I have to like explain again, why not? You know, so it's like, seems like it's a lot of education to the community and even our authorities to explain them why. You know, it's not like they don't want to, but at the same time they suffer. Like, for example, they don't have none of the kids in their care have a voucher. You know, they don't understand all the beauty that also can be helpful to them in their business.
awesome. Is there anything else you'd like to share with the group about how you all are reaching and serving family, friend, and neighbor caregivers? I know that you are doing some multitasking today.
Yes, I'm so sorry. Well, for example, I'm very active in my church, and it's a big church. So I'm always advocating about, hey, if you want to do some volunteering hours, you know, with us, stuff like that. So make them come and just be aware that these beautiful ladies are taking care of the kids of the people that provide the meals we have, you know, for the people that go and are working at the stores, that are taking care of others, that are in the community helping. So I feel like my job right now is more like educating the public about it, and also bringing, for example, we have an organization that we partner with, like once a month, they come and bring their best treat to the families. Or like we have another partner who has like a food bank. So we send them bags every week, no, every other week, for them and the families they serve. And we don't ask names, we just leave them in the porch. So they know that if they are food insecure, they have food with us. And if we had extra gift card, like we're always trying to love on them in a way that they know that we're there for them with education, but also with resources that they need.
Thank you, Aurora. We're really grateful that you could spend the time for us and for the love and care you provide to the family, friend, and neighbor caregivers in your community. We appreciate you being here.
Thank you so much for having me.
Yeah, we have a little bit of time, so I'm going to see if anybody on the call would like to share some of their experiences in reaching and serving family, friend, and neighbor caregivers.
I think somebody in the chat, I'm sorry, said something about the Latin community. I don't know if you want to read it.
Sure. Migdalia said, I have the same situation with Latino immigrants. As part of the FFN program, we support them to become LNL. However, If they do not have a social security, they cannot qualify for the FFN program. They can take care of one family. Migdalia, what state are you in? Do you want to give us a little bit more detail? So it sounds like there's a licensed exempt process in the state that Migdalia comes from. In North Carolina, where Aurora is working with family, friend, and neighbor caregivers, there is no licensed exempt status. So there's really only licensed and not recognized by the state. So I think that does make the conditions in which you work even that much harder. But the immigration issue, I think, is an issue that cuts across many states and really does pose a significant barrier to meeting and reaching family, friend, and neighbor caregivers.
Well, we have a fire alarm here, so I might have to leave.
Okay.
I'm so
No
sorry.
problem. That's okay. Thank you, Aurora.
Thank you. Bye.
I was going to open it up. I know that there are lots of organizations on the call that serve family, friend, and neighbor caregivers, and maybe I'll pick on a few of you. I don't know, Ada Marie or Tom Browning, if either of you want to share a little bit about how you use data to do outreach and engage family, friend, and neighbor caregivers in your work, or if Joyce would like to do that. Anybody else is welcome to. I'm just gonna, just picking on a few folks I know who might be willing to share without any preparation. Tom, do you want to share a little? Oh, go ahead.
I can say in West Virginia that our family, friend, and neighbors, they're actually called informal. It's called informal care, and they are technically have to register, but it's a whole different set of rules for them. But they still have to register with our state. You're not allowed to watch children in your home or anywhere if you are not registered with our state. Not even nobody. If you're going to be paid, if you're going to be paid by the state, that is. So, but yeah, they they do have their own set of licensing here, but it's just like it's not very big. It's like it's real informal.
Great. Thank you, Kathy. And Kathy is joining us from West Virginia. And I think a lot of states do that. They create a separate process for licensed exempt providers that operate in their homes. Would anybody else like to share? Tom, please go ahead.
Sure. I can on a couple things. I'm Tom in Chicago. Hello, everyone. My child care resource and referral agency I work for manages the Child Care Assistance Program, or the CCDF, and also we run the food program, CACFP. Data, at least for our county, is really easy to get because our state agency will basically give us a list of everyone who is on the program, the Child Care Assistance Program, and with either phone numbers or emails. And so anything done nationally helps inform us on what's still going on in our homes in Cook County. So I do appreciate the national data out there, so we can see the trends like we just saw earlier. Undocumented is really interesting, as we all know, throughout the country. Undocumented providers are not included in the Child Care Assistance Program. However, children are. So that's our emphasis. We have community connections with Spanish-speaking community-based organizations, one called Enlace here in Chicago. So we try to work with them to get the message out that their children can get into this program. But of course, we all know they have to find a documented provider. It's someone in their family. It could be their grandma, their aunt, their sister, their neighbor. They just need to find a documented person, and then the children can start receiving childcare. The provider will receive funds, and of course, we'll introduce the food program. Our undocumented children can apply through based on unhoused, which is homelessness, and can be based on, and this is expedited. This is what I want to say. They can be expedited through being unhoused, or they can be expedited if the parents are on a job search. So those are for documented and undocumented families, but we obviously utilize this. and we make sure the word is out there that all you need to do is find a documented person who'll take care of your kids, and we'll work to set them up. I don't know if anyone wants to share anything more. That's what come to my mind based on what we're talking about. I will also say, you know, I have a team of about 30, well, up to 30 people that work with non-licensed, and well, the CACFP, of course, works with licensed homes too. We've done very well since 2020, calling people, updating phone numbers, addresses, emails. We have certainly, since the pandemic, become a trusted messenger, because basically during the pandemic, we couldn't go in anywhere. So we built relationships on via phone, and we're very, we use a peer learning now on Zoom, where for any provider on our program comes and just between 6 and 15 people, and we have facilitators that talk about the issues of the day. It's not a training, it is support. And like mentioned earlier in this webinar or this meeting, there's a lot of funding out there for if you're on the program. So again, it stinks. The undocumented providers can't get the extra education or extra supplies. But we do, but for documented people who are on the CAC, who are on the child care, we use this peer learning to also constantly be a trusted messenger. But again, we just have staff members who already have relationships, so it's not even about the peer learning anymore. That actually brings in more new people, which is a really new people closer to us to make a more of a trusted messenger stance with them. That's what I got for the moment, Natalie. I don't know if you have anything else.
I appreciate it. I appreciate it. I mean, I think, you know, Tom is doing a lot of the things that, you know, we would hope that FFN serving organizations are able to do, which is, you know, recruiting and outreaching to providers, connecting providers to public resources, continuing to maintain and support them through the programs. The ability to do that is obviously different depending on the context in which you work. Maybe if there's one more person that would like to share their experience, either their successes in engaging FFN caregivers or challenges that you're having, as Aurora and Kathy raised. Going once. All right. Nobody wants to volunteer to share more. I'm going to turn it back. Oh, Heather?
Yeah, I was trying to get off of the video thing. So I'm a family childcare provider in the state of Nebraska. So I do have other roles that I work as a Step Up to Quality coach. So that's our quality rating system there. I also right now am coordinating a preschool development 4.0 grant, they're calling it, in our community, which is tied to helping providers get stipends from their employer for completing trainings and activities that are improving quality, and also helping to recruit people to become licensed. So what I have been trying to work on just on my own as a facilitator of our child care association that we just have in our community. And I will mention that I live in a very small rural community in Nebraska, in the central part of Nebraska, which is not diverse. We have a very low population of other than white families. So the things that you guys are talking about with the family, friend, and neighbor of, you know, undocumented, I'm sure that there are those cases, but we just have such a low population that we're just not aware of it. But what I wanted to talk about just a few minutes is I've been trying to engage with our family, friend, and neighbor partners, just to bring them in to help them, give them resources to improve the quality of care that they're giving to families, and maybe even just use it as a way to open the door to say, hey, you know, come talk to us about becoming licensed. come talk to us about what that could mean. There are lots of resources that can help you. So it's it's really difficult. And I know that you guys, because it's almost like they don't want to be known because they don't want to get in trouble. In our state, you know, we have licensed providers and then we have license exempt providers. License exempt can either refer to someone who is taking subsidy for childcare payment. And then if they do have subsidized children, they can be part of the food program. But otherwise, they cannot. They can only have 3 children. So that really limits their income too. But I'm sure probably more than them have more children. And what we worry about, or especially I worry about equality, is like them understanding like it's not very safe for you to have, 4 babies and, 3 other children by yourself. That's not providing quality care. I just would like to open the door to inform them and help them. We also have created a toy lending library within our community for and anybody who licensed centers, homes, people providing family, friend, and neighbor. Anybody can come and check out these amazing toy resources and take them back, and everything is quality learning. And also, again, a way to open the door and open these conversations and just hopefully, increase the licensed providers, because we really do have a childcare desert in our community. And it seems like every month you hear about somebody quitting. Even the family friend, they will move to a different place, and then suddenly, they might have 8 children that do not have a place, and there wasn't a place to begin with. So I don't know if I made sense when I was telling this. I was kind of rambling, but I just wanted to share like the challenges and what, kind of why I was on the call to listen. But I would really like to find a way to bring these providers in so that we can support them and let them know that there are resources and things to help them out.
Great.
So
Thank you, Heather. And I think, I want to pick on a couple things before I turn it over to Katie, which is that I think there is a growing interest, and I think the fact that there are 75 people on this call is a reflection of that growing interest, and the interest in kind of reaching and meeting the needs of family, friend and neighbor caregivers, is increasing. And I think Heather really articulated some of the things we don't quite know about this community if you're new to working with family, friend, and neighbor caregivers, right? Do they have issues with documentation or not? How many kids are they serving? What are their needs? And I think part of why we are so excited about the rapid data is that it's a starting point for us to go deeper in our individual communities, to know that most family, friend, and neighbor caregivers are caring for 1 or 2 kids, that most of them are, engaging in practices that we associate with quality, that their interests and the places we might engage them in our community to gain other resources or connect with the system are in different places, that maybe licensing based on who they are as a grandmom or, other attributes is not really the right path for them. Maybe it is. And I think part of why we're so excited about the data in Rapid is that it helps us start to build a more nuanced, a more full understanding of who the women and individuals are that are family, friend, and neighbor caregivers. And as systems, as organizations, and as policy leaders, we can be much more responsive and nuanced in how we think about building solutions and including family, friend, and neighbor caregivers in building the solutions we need to meet our, childcare shortages or whatever the case may be. So I'm sorry, Katie, I took us a little bit off track, but now Katie's going to talk about some really great opportunities for all of you to partner with Rapid and do more of this data collection to inform your work.
Thanks, Natalie, and thank you all for sharing. It's really enlightening to hear about some of your experiences and successes and challenges. And we might have some time at the end for some more of that if there's more people who want to share. But I did want to jump in to sharing a few details about what it means to be a rapid recruitment partner and to engage in the work and with us. And all of our existing recruitment partnerships look a little bit different, but there are some similarities and some kind of core ideas to how it functions. So as I mentioned earlier, Rapid collects initial data from participants who are taking the survey for the first time on a monthly basis. And we call those initial recruitment surveys, which are fielded every month. And then our recruitment partners have about a 3-week window during which the survey is open each month to share about the opportunity to participate in the survey with providers in their network who they work with. And oftentimes we see partners doing this by including information about the survey opportunity in their newsletter or other email communications, on flyers at in-person gatherings or meetings or events, or sometimes via text message or other ways that different organizations engage with the people they work with. And because recruitment happens each month, recruitment partners don't need to recruit every month. You could skip a month, recruit every other month. There's some flexibility there, and also some flexibility in trying different outreach methods from month to month. And we have the ability to kind of see where traffic is coming from and what outreach methods are proving to reach the most providers. So the Rapid team provides a recruitment toolkit that includes sample messaging about the survey, as well as a link and a QR code that's scannable with a mobile device for that given month that providers can use to take the survey. And we'll take a look at what one of those toolkits looks like on the next slide. But Rapid also pays providers who complete the survey a $5 gift card about 2 weeks after they complete the survey. And typically, once we've collected around 30 valid responses from a specific recruitment partner, we can also then share summary data back with that organization. So they can review the summary data and use it in ways that are helpful to them and their work. So here is a quick look on the left of one of our recruitment toolkits. And you'll see the link and the QR code to take that month's survey is front and center. And then there are also, like I mentioned, sample emails, text messages, newsletter content, and flyers in English and Spanish that partners can use and can also customize for their outreach efforts. These can just be a starting point and of course don't need to be used, but are offered as a way to, as a starting place. So before we get into Q&A, I'll share some information about the recruitment stipends that we're offering to organizations that work directly with FFN caregivers or who want to work directly with FFN caregivers and who could benefit from access to additional resources to recruit them to participate in Rapid survey of childcare providers and to learn from their experiences. And so we'll be offering $2,500 to $5,000 stipends to around 5 organizations who'd like to support recruitment efforts. And our goal is to build awareness about the Rapid survey, to build the sample of FFN providers in our survey, and also to share the findings more broadly and to help to have the findings be useful to your organizations as well. So we hope that by gathering gathering information from FFN providers you work with about their experiences can help to inform your work and be useful to you as well. I want to underscore that. So some examples of how we envision that the stipends could be used, not an exhaustive list, but could include communication products like flyers, or other collateral to cover costs related to hosting an event to recruit providers to the survey or a meeting, or to offset staff time supporting recruitment of providers to the survey. And we do have a brief stipend application that will be due in about 2 weeks on Friday, May 3rd, and I'll share a link to that momentarily in the chat, and we'll send it in a follow-up email to everyone who registered today as well. It's a very simple Google form with about 12 questions, and half of them are contact information for the key contact at the organization. So I will put that in the chat. And then we would look to have organizations who receive a stipend begin recruiting for either the June or July survey and continue recruitment activities through the end of this year, 2024. So of course, we could extend our partnership beyond that, but as a starting place, and that's kind of the time period that we're looking at for this stipend opportunity. And during the partnership period, we'd expect stipend recipients to participate in informal check-ins at the mid and end point, just to discuss successes and challenges that they're encountering and ways that we can support. And we'd also communicate monthly with recruitment partners about how the recruitment efforts are going. So I also just wanted to take a moment to acknowledge that there may be some folks on the call who don't currently engage with FFN providers or who want to, and regardless of that, there are other ways to engage in the work that Rapid is doing, and that you can connect with Rapid if you'd like. So you can also sign up for our newsletter on our website, which is rapidsurveyproject.com. And we also have a request for proposals out, which is posted on the Stanford Center and Early Childhood website, that's focused on community survey work. And actually the proposals for that are due tomorrow. We do now have some time for questions, and I haven't had a chance to monitor the chat too closely, so there could have been some questions that have come in, but want to make sure we have a chance to answer any questions you all have. And I'll stop sharing my screen so we can see each other better for a bit here before we wrap up.
Great. Katie, I will maybe moderate and share the questions with you from the chat. If folks do want to just come off chat and talk, if you could raise your hand and or put your question in the chat, and I can ask it live. So there's a question from Miguel about how large the current FFN sample in Rapid is, and if you can share any attributes of the existing sample.
Yes. Let me find that information. I don't have it top of mind, but I will find it really quickly and be able to share that with you, and I can put it in the chat too. Sorry for not having that front.
Actually, it looks like one of your colleagues may have responded in the chat and said that
great.
in March of 2024, there are 434 FFNs in the data set. Megan asked if the data is aggregated by state.
No.
And is that because the sample size is too small, Katie?
It's for a few reasons. I think that we, in some cases, the sample size is too small and not representative of states. So that's one of the reasons. And yeah, I think we get that question a lot, if it can be disaggregated by state, and are at the moment, I think, not able to do that as much as maybe folks would like, but definitely on our radar, and we hear that there's a hope for that. And we do have some statewide surveys in addition to our national surveys that I've touched on today, including in the state of California, and we're getting up and running in Connecticut and Ohio as well. So there are some separate initiatives that are collecting data at the state level specifically.
But I want to go back to something that you mentioned in the presentation, that if a partner has reached a sample of 30 or more providers, they could get some customized data about their site. Is that correct?
Correct.
Great. So community level, maybe not necessarily state.
Mm-hmm.
Great. Other questions? Does anybody want to ask any more questions of Katie? Also open the floor to share any best practices in terms of recruiting FFN providers to data collection efforts. Please, Tom, go ahead.
Katie, I'm kind of interested in the localized data. I mean, I would be fine with just participating and promoting it without applying for the stipend. I think one of the other organizations can. But I would be interested in the possibility if we do a promotion throughout Cook County, pretty strong, if we could get data back from based on just our efforts of promotion.
Yes, definitely. And I would encourage anyone who's interested in that, please reach out to me. I'll make sure to put my contact information in the chat. And we can do that. We just, like to get to that point where we have heard from about 30 providers so that we can share that summary data, and we would be happy to provide data back to folks who are recruiting.
Great. Well, I'll be in contact.
Great. Thanks, Tom.
Leslie asked a question about whether there's a hope to have state data and then on a more regular basis. And maybe, Katie, it would be worth just sharing how frequently the provider data is updated and sort of the goal for Rapid in terms of expanding the FFN data set to be able to disaggregate at the state level.
Yes. Regarding plans for state data collection, I don't really have enough information to speak to if that's in the cards in the near future. And I apologize for that. I can try to gather more information and follow up directly with anyone who raised that question. And Natalie, the second part of your question was
how frequently the data is updated.
Oh, yes. So the responses that come in through our national surveys are cleaned and analyzed each month. And we do analyze like those core topic areas that I talked about at the beginning, like material hardship, health and well-being, childcare, every month. And then we also add in other what we call modules or groups of questions every month to our ongoing surveys that can kind of be about whatever might be going on or topics of interest of some of our partners. And we do some more separate analyses kind of as needed or as those different modules are included in the survey. But our core topic areas are analyzed monthly.
And Leslie, maybe this is a helpful example, but at Homegrown, we focus on a couple of specific policy areas like provider economic hardship, housing, and hunger. And so, we're able to look at monthly trend lines as it relates to this data and can think about whether things like the end of pandemic expansion of SNAP is affecting home-based childcare providers, both FFN and FCC, right? We can see, the date at which those benefits ended and whether provider hunger has changed. So that monthly cadence of the data is really helpful from a policy perspective to, can't say for sure that it's causal, but we can make some assumptions about what's changing the lives and livelihoods of providers from a public policy perspective. I hope that answers your question, Leslie. And if we did not answer your question, please feel free to come off mute and ask it again. It sounds like there are a number of people in the chat who are sharing information about their ability to reach and connect with family, friend, and neighbor caregivers. So we are super excited, for you to connect with Katie and her team and think about ways to recruit for the survey. I'd love to see if there's just a couple more questions or comments anybody would like to share. Okay, I'm going to turn it back over to Katie to close us out then.
Thank you. I'm just going to pop our slides back up here one more time. and wanted to share a few things in closing. First of all, thanks for the questions that are coming in the chat, and feel free to continue to reach out with any questions. And by the end of the week, you can expect to receive a copy of the slides from today's meeting, a recording, and a link to the stipend application via email if you registered and you're here. So you registered, so you'll all receive one of those. And then, as I mentioned, the stipend application will be due on Friday, May 3rd at 8 p.m. Eastern, 5 p.m. Pacific. And we expect to make funding decisions by mid-May. And I'm glad Tom brought this up a bit ago, but if you're not interested in pursuing the stipend and want to continue to, or want to engage anyway, or reach out and learn more about the opportunities to engage in recruitment activities, please be in touch. I'll put my email in the chat right now. And yeah, please don't hesitate to reach out. Thank you all so much for your time today and for all the work that you do.
Thanks, everybody. We appreciate you joining us, and we'll be in touch with those next steps later in the week. Take care.